Endometriosis is metastatic growth of endometrial cells on the peritoneum with secondary fibrous induction, forming bowel to peritoneal adhesions and inflammation, bleeding and obstruction, etc. Stealth pathogens must be removed, scars reversed, and abnormal hormonal estrogenic metabolism must be normalized. Laser laparoscopic ablation of the lesion is the best surgical approach to the endometriosis, augmented with a natural detox, anti-inflammatory and pathogenic clearance. Most of the women who suffer from endometriosis do not get to know about it normally, as there's no symptoms. Infertility and pelvic pain are among the most common symptoms in those who experience the symptoms of the problem. Women may suffer from pain when they have intercourse, while urinating or bowel movements. Women who suffer from the condition may also experience pain before or during menstruation. Women may experience the alteration in the level of pain every month. Diarrhea, pain in the back, heavy bleeding during menstruation, and constipation are some other common symptoms of endometriosis. Omega-3 fatty acids are the healthy kind of fat, unlike saturated and trans fats. Eating foods that are rich in omega-3 helps to fight inflammation, to reduce a woman's risk of developing endometriosis, and to relieve menstrual discomfort. Doses of an EPA-DHA molecularly distilled fish oil blend can range from 3 to 9 grams per day. Foods that are rich in fibre, such as whole grains, vegetables and fruits, are generally good for overall health, but they're especially beneficial for women with endometriosis. These foods are packed with nutrients, and it helps you to feel full for longer, and it helps you to refrain from eating junk food, which increases inflammation. The fibre-rich food eases the endometriosis symptoms due to their antioxidant content, as it can reduce inflammation in the body and reduce the levels of estrogen, all of which play an important role in the endometriosis. Many women with endometriosis also have irritable bowel syndrome, and eating more fibre can improve the IBS symptoms. However, when eating fruits loaded with fibre, women with endometriosis should consume 1 to 2 servings only of fruit with a low glycemic index, such as apples, citrus fruit, raspberry, peaches and plums. Cruciferous veg like broccoli, cauliflower, cress, kale, sprouts and turnips are rich in B vitamins, and these can help the liver to break down the estrogen and strengthen the immune system. These vegetables also contain magnesium, which helps to relax the intestinal and the uterine muscles, potentially easing the endometriosis symptoms. Magnesium can also help with energy levels, and it's often depleted due to inflammation and stress. It's anti-inflammatory and it lowers the oxidative stress, which is often seen in women with endometriosis. To determine your dose, use magnesium bisglycinate. Gradually increase your dose until side effects like stomach discomfort or diarrhea are noticed. Then slowly reduce the dose until you can determine your maximum daily tolerable amount that doesn't cause any side effects. As magnesium is required by over 300 enzymatic processes in the body, it can have profound benefits after a few months of supplementation. Endometriosis often results in heavy menstrual periods in which the levels of iron decline. To compensate for this, it's important to eat foods that are rich in iron, both heme and non-heme iron. Heme iron comes from fish and eggs, while non-heme iron can be found in leafy green vegetables, beetroot and dried apricots. Try to avoid synthetic iron supplements, as new research seems to suggest that these have negative health consequences. Iron absorption is enhanced when it's taken with vitamin C. Studies imply that vitamin C can play a protective or therapeutic role in endometriosis. Studies have shown that diets of women with endometriosis include less antioxidant, and antioxidant intake is therefore beneficial for decreasing the pelvic pain. The best form of vitamin C would be liposomal vitamin C. You can learn how to make this cheaply in an ultrasonic cleaner. The next best form would be a non-acidic pH-buffered vitamin C, and the worst kind would be a cheap acidic ascorbic acid. Quercetin is a bioflavonoid, and it can be found in elderberry juice. It can enhance the absorption of vitamin C, zinc and shikimic acid. Quercetin regulates cell proliferation, and it also regulates human endometriosis cells. Quercetin significantly decreases endometriosis cell proliferation in cell lines. Zinc is another important mineral for endometriosis because it's linked to inflammation and the immune system. Zinc also offers antioxidant benefits and it's supportive of tissue repair. Doses can range from 50 to 30 milligrams per day, but be sure to get a bioavailable form of zinc, as many forms have poor bioavailability. A study on in vitro effects of vitamin D on human endometriosis stromal cells found that the vitamin D significantly reduced the interleukin-1 beta and tumor necrotizing factor alpha inflammatory response, and it also reported fewer endometrial stromal cells and it reduced DNA synthesis. Most people are deficient in vitamin D. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3. Resveratrol is the anti-aging molecule found naturally in small amounts in red wine. A study indicated that resveratrol significantly reduced the volume of endometriotic lesions. Histological scores were also decreased in the treatment group. Therefore, resveratrol is a phytochemical with potential ameliorative effects in endometriosis, probably due to its antioxidative potency. Typical doses range from 500 to 1000 milligrams per day in the form of trans resveratrol. Curcumin can downregulate inflammation and oxidative stress in endometriosis. Moreover, the curcumin can directly act on invasion, adhesion, apoptosis, and angiogenesis in the endometrial lesion. The use of curcumin could be an interesting addition in the dietary prevention and disease management for women. Doses of curcumin can range from 1000 up to 5000 milligrams per day. However, due to its poor bioavailability, its absorption should be enhanced by taking it with either biopterin, which is a black pepper extract, or by taking it with a fat such as coconut oil, butter, ghee, or fish oil. Some people with an underactive thyroid experience endometriosis. Some supplements to help hypothyroidism are selenium, nascent iodine, and tyrosine. Check out my video on hypothyroidism for more information about this. Endometriosis can be explained by MTHFR mutations. For example, polymorphisms of the MTHFR induce oxidative stress through the increased homocysteine level. You can Google a list of common questions to help determine if you're an undermethylator due to an MTHFR polymorphism, and then see if you can easily correct this by supplementing with high doses of B vitamins, methionine, MSM, and trimethylglycine. Studies have shown that a vitamin K1 deficiency occurs in higher rates in endometriosis patients with severe bleeding. Results of a study have shown that garlic extract can reduce the symptoms of endometriosis. It can reduce pelvic pain and back pain, dysmenorrhea and dyspareunia, which are essentially the symptoms of endometriosis. These pains are the results of inflammation, which is the underlying cause of the endometriosis. A team of researchers have suggested that all patients who are diagnosed with endometriosis should start taking 400 micrograms of folic acid in advance before conception in order to reduce the risk of preterm birth and spina bifida in the fetus, leading to anencephaly. A tetrahydrofolate form would be the most recommended form. Pine bark is rich in several bioflavonoids that have both anti-inflammatory and antioxidant effects. One small study suggests that the pine bark extract, when used alongside oral contraceptives, could reduce endometriosis pain. Endometriosis is heavily linked to hormonal imbalances. This can be influenced by stress levels. Doctors recommend practicing meditation to reduce the stress levels. These exercises also help to manage pain. The higher levels of serum cortisol in women with endometriosis might be associated with either physical or emotional stress, which may contribute to the development of the disease. Adaptogens such as holy basil, also known as tulsi, can help to control cortisol. Also, the supplement phosphatidylserine when taken at doses of 600 to 800 milligrams per day. Another way to help to regulate stress and cortisol is sleep. A study reveals that sleep quality of women with endometriosis is associated with a poorer quality of life, more depressive symptoms and bladder pain syndrome, possibly as a result of a sleep disorder, and changes in the melatonin level that can have a diverse range of effects on the reproductive system. See my other video on herbs for sleep to learn more about the natural ways to help to promote a healthy sleep cycle, and my video on melatonin. Studies have linked endometriosis to chronic inflammation and high cholesterol, potentially increasing the risk of heart disease. There's many ways to naturally treat high cholesterol, such as supplementing with hawthorn, omega-3 fish oil, niacin and garlic. Also exercise and a low sugar diet to reduce the inflammation can also help. Although soy products contain phytoestrogens, some of which convert testosterone into estrogen, eating soy is actually good for people with endometriosis. Research shows that women whose urine samples contain more soy isoflavones had a lower risk of severe endometriosis. According to new research, consuming red meat such as beef or ham increases your risk of endometriosis by 80 to 100%. Being physically active is one of the best lifestyle changes that you can make for managing the symptoms of endometriosis. Exercise like yoga can help to improve menstrual flow, thus preventing the progression of the disease. Additionally, exercise also increases the levels of endorphins in the blood, which can help to relieve pain. Avoiding environmental toxins with estrogenic effects like pesticides and herbicides can help to prevent the worsening of endometriosis. This is according to research. One example is the link that's been established with the use of non-stick pans and its hormone-disrupting effect, triggering earlier menopause in women. Endometriosis has not yet been classified as an autoimmune condition, but it may increase the risk for autoimmune conditions. The inflammatory nature of the endometriosis seems to trigger an imbalance in the immune system. Our immune system protects our body from invaders, but immune systems can get out of balance. Check out my video on autoimmune treatment to see some natural ways to help with this condition. There's currently no known cure for endometriosis. This has led to a growing number of otherwise healthy women, those younger than 35, with no other medical condition, to opt for a hysterectomy, which is when doctors surgically remove all or part of the uterus. Having a hysterectomy before the age of 35 heightens the risk of congestive heart failure by a massive 400%. Scientists have also said that removing the uterus at an early age could double the risk of coronary artery disease. The cause lies in the intricate and still not fully understood relationship between hormones and health. New research highlights this even further. Gynecologists have warned that hysterectomies done before the age of 35 increase a woman's chance of being obese by 18%, having lipid abnormalities by 14%, and suffering from high blood pressure by 13%. For more information about herbs or supplements mentioned in this presentation, check out my website.